Welcome, everybody, and thank you so much for taking your time today to join us and learn more about the University of Miami's Children's Hearing Program. Remember that throughout your listening to this conversation, please feel free to use the question or the Q&A function at the bottom of your screen to insert any questions that you might have for Dr. Angeli or Dr. Sanchez. My name is Yvette Cejas, and I am an associate professor and director of the Family Support Services here as part of the Children's Hearing Program at the University of Miami. I'm also a clinical psychologist who has the honor to be able to work with these amazing families, helping to provide evaluation services as well as counseling services for this very unique population. I've personally been able to see the major impact that CHP, or the Children's Hearing Program, has on the social and emotional development of pediatric hearing loss patients. Many times, this can be a hearing loss can be an amazing or actually a devastating diagnosis on day one. And I can remember vividly sitting with many families on day one who are crying and are wondering, how are we going to make it through this difficult time? But what I could say is that, thanks to CHP, these families are empowered and they're build the strength to be able to make it through this hearing loss journey, which at the end becomes positive. Through the support of this multidisciplinary team that you're going to be hearing about today, we're able to offer many services that makes us unique. Many of those same families that I talked about where they were struggling at first end up coming back. They end up coming to our community events that you're going to be hearing about. They end up finding ways to support our program so that we can continue to expand and meet the unique needs of pediatric hearing loss patients. So this is why I'm gratefully honored to be able to moderate this session along with my colleagues, Dr. Angeli and Dr. Sanchez. And I can't wait for you all to hear and learn more about pediatric hearing loss, but also the amazing services that the Children's Hearing Program offers. So without further ado, I'd like to go ahead and pass on the mic to Dr. Angeli, who's going to go ahead and give him his introduction.
Good morning, everyone. And I want to begin by thanking you for attending this web seminar and for your continued support to our programs. My name is Dr. Simon Angeli. I'm a neuro-otologist and professor of otolaryngology at the University of Miami Miller School of Medicine. I also have the distinction or the privilege of directing the University of Miami Ear Institute. Part of this Ear Institute is our Children Hearing Program, which is a very essential part of what we do. Many of us in the Institute are from different specialties. Some of us are surgeons, some others are audiologists, speech therapists, psychologists, diagnostic specialists, as well as researchers who work together to try to, crack the mystery of hearing loss and help our patients with this disability. So I'm going to let now my colleague, Dr. Sanchez, to talk to you about her part in this project.
Thank you, Dr. Angeli, and thank you everybody for attending this webinar. I'm super excited to participate and be here to just talk more about pediatric hearing loss and the services that the Children's Hearing Program provides. My name is Crisanda Sanchez. I am a pediatric audiologist and an assistant professor of otolaryngology here at the University of Miami. I also have the pleasure of currently being the interim director of the Children's Hearing Program. I personally am a Miami native. I'm a Latina. I am a bilingual provider, which in the field of audiology is very few and far between, especially for pediatrics. In my clinical practice, I work with diagnosing infants and children with hearing loss and helping them hear by fitting devices or programming their cochlear implants. And, ultimately, I'm really excited for this opportunity to talk about childhood hearing loss here with my colleagues. So thank you.
Awesome. And thank you so much, Dr. Angeli and Dr. Sanchez for taking the time to kind of talk, have these conversations. And I think we'll go ahead and get started. So Dr. Sanchez, the first question is actually for you. So can you tell us what exactly is the Children's Hearing Program?
Yes, the Children's Hearing Program, or often what we refer to as CHP, it's really a one-of-a-kind program dedicated to the comprehensive management of pediatric hearing loss. We are a program aimed to really minimize the impact of childhood hearing loss through early intervention, multidisciplinary care, and family-centered care. We are part of the UHealth Ear Institute, as Dr. Angeli mentioned, and we're located and housed within the Department of ENT. We offer comprehensive services for children ages 0 all the way up to 18 and sometimes a little older. And we serve upwards of 5,000 children in the South Florida area.
Wow, and obviously that sounds like a really big mission in kind of providing that comprehensive care. But can you tell us a little bit more specifically about what services does CHP offer to children and families?
Yes, so of course, as a part of a pediatric hearing loss program, we offer, our physicians are the neurotologists and our ENTs, like Dr. Angeli, inclusive of audiology, like myself. We have a pediatric audiologist dedicated to working with these families. But in addition to those two medical specialists, we have speech language pathologists who specialize in a very specialized therapy for children who have hearing loss called auditory verbal therapy. We have clinical psychologists like yourself, Dr. Zejas. We have a social worker, an educator, and we also have clinical assistants in our clinic to support these families. And these are really, it's a one-of-a-kind service delivery model that enhances our ability to manage and treat really the whole child, not just their ears or their hearing. We really kind of take a larger focus and help the families kind of progress with this diagnosis. And in fact, CHP's dynamic team is really the only one to exist in the state of Florida. And quite frankly, I don't know of any other programs that really exist across the nation or even the world that have all of these really highly specialized individuals working under one roof. So I'm happy and really honored to be a part of this team, but it's a really special place.
Wow, and yeah, I know for all of us, I'm sure we kind of have that really special place in our heart. But Dr. Angeli, I think the next question, maybe if we could take a step back for those listeners who are joining us today that might not know, and probably one of the first questions that you get asked by those parents that come through that door is, what causes pediatric hearing loss?
That's a great question. And before I get into that question, I just want to add, hearing loss is not very visible disability. And many of us walk around, to the public, and they're not aware that somebody has a significant hearing loss. And hearing loss has a very important impact on the life of people who suffer hearing loss, particularly children. A significant hearing loss, if it's not habilitated properly, can result in significant consequences, not just not being able to hear, but also not being able to develop appropriate speech or communicating with people, being marginalized because the person cannot participate in social activities given the hearing loss, and many other things in education, scholarship, professional development. And that is why we have a multidisciplinary team. That's why we have a team composed of many different specialists that can tackle each and every one of the problems or the consequences of the hearing loss. So that is why we have a children hearing program. It's not just you come in to have a diagnosis of hearing loss and then you get put a prosthesis. We evaluate the patient comprehensively, and we tackle every one of the consequences of the hearing loss, from the educational, professional, and social issues that may arise from the hearing loss. Not only of the child who is affected by the hearing loss, but many times we have to treat the entire family dealing with the consequences of a child who's hearing impaired. Having said that, what are the causes of hearing loss? There are many, many causes of hearing loss. Particularly in childhood, we can divide them in two major causes. One is genetic, a gene defect that can be passed on from parents to children. And the other 50% of cases would be what we call acquired. That means that it's not genetic, but it's a cause. There is a cause in the environment, an infection, a virus, a problem during pregnancy, a severe case of infection of the inner ear or meningitis, sometimes a certain antibiotics or drugs or chemotherapy agents can cause significant hearing loss. Some children will have ear infections, trauma, for example, a head injury. Those can all cause different types and different degrees of hearing loss.
Yeah, and actually one of our the audience members actually had sent it this question in of, can you expand more about the genetic aspect of hearing loss? And is there anything that we already know from research that kind of tells us about this area?
Yeah, I've been involved in the evaluation and treatment of genetic hearing loss for over 25 years. This is a passion of mine. And we've been studying particularly the different gene defects that we find in our community. A few years ago, it was difficult to do these studies because we didn't have the tools that we have today. We have very sophisticated tools now. We can, as you know, from just a vocal swab from saliva, we can identify the DNA, which is the genes in our, what houses the genes in our body. And we can look at specifically at genes that have to do with hearing loss. And there are over 100 genes that do hearing loss. And the interesting thing is that all of these genes more or less cause only hearing loss. But there are very different genes, very different parts of the body that are affected by mutations in these genes. And that speaks of the complexity of the ear as an organ, that so many different processes can result in the same result, which is the hearing loss. Well, from diagnosing the hearing loss, the genetic hearing loss, we have made great advances. We can nowadays, we have a three-step process where we can start first looking for the most common genetic defects that we know in the community. And if we find the gene there, then we can move on to a more complex testing, including a study of the entire genome, of the entire group of genes in somebody's body. And we extend this to families sometimes. When we find a specific gene defect, we can offer the gene testing to the family and the siblings of the child with hearing loss. And in this manner, we can create a picture of the defect, the gene defect, the causes of the hearing loss. And with that information, we can tell whether the hearing loss is going to be stable or whether it's going to progress into greater degrees of hearing loss, whether we can use one type of treatment or other treatment, or whether we have to be aware of some other medical problems that this gene defect that is only manifesting now with hearing loss, all these other medical problems that can occur in the future or are occurring now. So as I said, there are more than 100 genes, so we have many more than 100 possibilities, clinical possibilities. And that's why it's so important to have a gene defect, because not only a gene study, not only because we can tell what gene defect is causing the hearing loss, but also we avoid doing a number of tests that are necessary. You know, if you with a simple saliva test can detect a type of hearing loss, you don't have to look elsewhere for the cause of hearing loss. You don't need to start doing expensive testing or some of their invasive testing. So these are changed completely the way we evaluate children with hearing loss. Yeah. Now, we don't have available genetic therapies for hearing loss yet. We are working on many different ways of treating genetic hearing loss. But we know that for some patients with some types of genetic hearing loss, we have either medications, and some of these medications are even as simple as vitamins that can delay the worsening of the hearing loss. So unfortunately, we have these options for only a small number of genetic hearing losses, but this number of cases that are being treated are increasing and increasing as our knowledge of genetic hearing loss increases. So that's why we're very keen on doing genetic testing, in inquiring about the exact mechanism that is causing the hearing loss, which we can tell from the genetic defect. And then we have ways of manipulating, in some cases, that mechanism to prevent worsening of the hearing loss.
Yeah, wow, that's, it's amazing to hear how the sensitivity of some of these tests, like you said, like the saliva swab, can make such a difference. And also truly great to hear that, hearing loss is now part of that whole thing of precision medicine that could guide what someone like you as a physician can then help to better inform the family to kind of find better, treatment options. Dr. Sanchez, given, Dr. Angeli just listed all of these risk factors and talks about genetic hearing loss, but how common is pediatric hearing loss?
Yeah, obviously there's some varied statistics, but generally speaking, it's about 2 to 3 of every 1,000 children born in the United States are born with some detectable level of hearing loss in either one or both of their ears. And another interesting finding that I think a lot of our parents, as we're navigating this journey, are really surprised to know is that nearly 90% of these children who are diagnosed with hearing loss are born to hearing parents, and maybe they've never really have met anybody with hearing loss, or nobody in their family have had, detectable hearing loss that was impacted. So they really kind of are surprised by this diagnosis. And, a lot of people think that, oh, we diagnose these children and, it's probably a long-standing family history. And that can be the case for some of our kids, but the majority, this is a new diagnosis and something that's pretty alarming for the families. And we're trying, we're starting from that point to really navigate these children on this journey for them.
Now, kind of along those same lines, how early can you diagnose hearing loss in children?
We can diagnose hearing loss as early as days old. Thankfully, to the advent of newborn hearing screenings, children have their hearing screened before they're discharged from the hospital. And, we have national mandates that we should be following if a baby is identified as, a referred screening. And those mandates really want us as audiologists to make sure that we're screening for hearing before 1 month old. We are diagnosing a hearing loss before 3 months old, and we are fitting them with some form of device by 6 months old. And the reason of that is because we want to ensure that we are really achieving some early intervention. And though this effort towards early intervention is really due to the fact that we know that hearing loss impacts overall childhood development, like Dr. Angeli already alluded, there are a lot of risks that are associated with untreated hearing loss. And our goal is to make sure that we mitigate those delays by treating as early as possible. So I think some people are always surprised that, babies are days old and we already can have a good understanding of how the auditory system is functioning with that newborn hearing screening.
And Dr. Angeli, in your previous kind of response, you started to mention a prosthesis. So along those lines, what exactly is that, or what exactly are treatment options for hearing loss that people can consider?
When we talk about hearing loss, we talk about a wide spectrum of degrees of hearing loss, types of hearing loss, and whether the hearing loss is unilateral or in both ears. So depends on the presentation, on the picture. Is what the treatment is designed based to solve the specific problem. We traditionally, there are many, when we talk about prosthesis, we talk about implantable devices that can work to solve one specific problem. For example, the simplest device or prosthesis that we can implant is a middle ear. The middle ear has 3 little ear bones, and sometimes infections cause erosion or destruction of these little ear bones. Therefore, the eardrum cannot send the signals to the inner ear to be transformed into electrical signals, which is the language of the brain. So the brain cannot hear if the sound doesn't reach the brain. So sometimes what we need to do is just bridge that gap with a small middle ear prosthesis, with a little artificial ear bone that in the middle ear will do the function of otherwise absent or malfunctioning ear bone. On the other spectrum of prosthesis, we have cochlear implants. Cochlear implants are electronic devices that transform sound into electrical signals, and these electrical signals are delivered by this cochlear implant to the hearing nerve. And then the hearing nerve carries the signals to the brain. And then, wow, we hear, because the brain has to be aware of this or receive these electrical signals from the inner ear to be able to hear. So the cochlear implant is substituting for the cochlea. The cochlea is the inner ear. And the inner ear is a very important organ because it does that big transition between sound, the sound waves, into electrical signals. That's what the inner ear does. And when the inner ear doesn't function, we give them a prosthetic inner ear, which is the cochlear implant. Does that for the body. So the cochlear implant will receive sound through a microphone, transform that sound into electrical signals, and then the signals are delivered by the little cables inside the inner ear that come in contact with the hearing nerve.
Yeah, and I can obviously say, as someone who's witnessed the amazing work that you have done, as a surgeon, right, to implant some of these individuals, and then Dr. Sanchez, who programs these devices, that they could be life-changing in many ways, and kind of by that providing that auditory access, many of these individuals can learn how to listen and talk, which is a myth, right? That many people think that if you have hearing loss or if you're deaf, that's not an opportunity. So it's amazing to see with this technology nowadays, we can make that difference in many individuals' lives. And we did have another question for you, Dr. Angeli, that came through the Q&A related to what you were talking about earlier with the genetic hearing loss. It's from an adult who actually has been diagnosed with significant hearing loss, but as an adult. And they're wondering if there's any testing that their children, even though they don't have hearing loss right now, if they should, get or seek out genetic testing for them. And if so, what do you recommend that they do in terms of next steps?
Well, that's a very good question. And genetic hearing loss can cause hearing loss at birth, but it can also cause a progressive hearing loss that may not manifest until later in life, even in adulthood. So it's because there are so many genes involved and so many different mutations can cause the gene to either malfunction completely or only function part of the, or only have parts of the function, which will make the gene get old or the mechanism get old sooner rather than later. So some people get premature hearing loss, if you will, for a genetic defect. So typically we would see these, we start with a family history. We inquire whether the patient has any other relatives with hearing loss or some other associated medical conditions that can also be transmitted through the same gene. So for example, diabetes and hearing loss can be a feature of a syndrome, a genetic type of hearing loss affecting the maternal line. So we make questions that can help us search or be suspicious of a genetic component of the hearing loss. Now, is it worth doing a genetic testing if you don't have hearing loss? Well, that's controversial. Most societies will tell you that unless you have a strong family history or a strong clinical reason to do a genetic testing, don't do genetic testing if the patient is not affected, because then you may find things that may worry people or make them more concerned about things that are not there. So obviously it's a shared decision between the doctor and the family. But in general terms, unless I see a strong family history of hearing loss or some type of constellation of symptoms that suggest a hereditary hearing loss, I prefer to reserve the genetic testing for those who have the genetic hearing loss. For those who have a hearing loss in their hearing test. So I would start by doing a hearing test first.
Wonderful. And I know you kind of, Dr. Sanchez, the next question is for you, and just expanding on something that Dr. Angeli kind of talked about even earlier about potentially that untreated hearing loss and how sometimes that causes isolation and things that are far from hearing. Can you kind of talk more about how hearing loss might affect a child's actual overall development?
Yeah, of course. I think, the most fundamental and probably the biggest impact that hearing loss has on a child is, and probably the most obvious, is their speech and language development. As humans, we need to hear clearly in order to speak clearly. We need to have an auditory feedback where what we hear is how we're producing speech. And those two systems kind of work interchangeably. And so that is the immediate impact that we talk to parents just at the diagnosis of these are the risks of, if speaking. And when we talk about speaking, we talk about speaking orally, communicating via voice and in language. And there's many forms of communication that, we provide and offer as options for our families, of course. But most of our families, as I mentioned before, since 90% of children are born to hearing parents, they, oftentimes the parents decide, well, we want our child to speak just like we do. And so by providing, the resources from the Children's Hearing Program, like auditory verbal therapy, we can ensure that these children, we mitigate or we kind of reduce the impact of the delays that speech can be affected by their hearing. But in addition to speech and language, of course, the other risk is poor academic performance. So oftentimes, hearing loss, if not addressed early, can lead to children really struggling in school, which makes sense. If they can't hear clearly, their academic progress is going to be at risk. And probably more in your lane, Dr. Sejas, is really the bigger umbrella and really the focus of what we do. And this is largely the unseen aspect of hearing loss, which is that social and emotional difficulties that these children may present with. Firstly, the parents, right, receiving that diagnosis and really learning how to navigate a child, having a child that has hearing loss and the impact of that. And then as the children transition and really kind of develop their own identity, they often struggle with maybe feeling, isolated and just socially different because of their hearing loss. And so having resources like ours to really support the family across every aspect of their journey is really the most important thing. And this is largely particularly why that early intervention, and as I mentioned before, that's intervening before 3 months of age, is key to ensuring that these children can develop these skills and really be comparable to their normal hearing peers. We want, these kiddos to just, function just like a normal hearing child would, as long as we can intervene as early as possible.
Yeah, and absolutely, both of you have kind of hit many kind of different points in terms of it's not just about hearing, but with untreated or undiagnosed, without proper intervention that your program, the CHP program, offers, these children are at risk for these academic delays. They're at risk for being socially isolated. And a little bit of even what Dr. Angeli said is that this can go even into adulthood. So it could affect, graduating from universities. It could higher education. It could affect your ability to kind of succeed, right? In employment, all things that are important. And then also, we all know that there's research and data out there to also say that there's a societal impact. There's a larger cost if we don't address these things early on. So it's amazing to hear from both of your perspectives that impact that if we don't get these things done in a timely manner, what can it affect? So I've heard from you about the importance of intervening, diagnosing. Dr. Angeli's even talked about genetic hearing loss. But all of these services sound great. But Dr. Sanchez, are all of these things covered by insurance?
Yeah, that is the $1 million question, isn't it? These services are crucial, and it's really imperative that we provide these families this holistic approach, this really interdisciplinary approach. But in fact, most of them are actually not covered by insurance. Specifically on our team, our educator and our social worker offer no reimbursement from commercial insurance. So, in a modern medical system, these positions would be really hard to support because, sometimes hospitals may say, well, if there's no reimbursement, how can we sustain a position like this? And actually, Dr. Sejas, part of your role is often not covered or, and it's really a shame that sometimes the healthcare field doesn't really recognize the importance of these services. However, thankfully, through the generous support from donors that have already donated to the Children's Hearing Program, we have been able to provide these services. And, in this traditional medical model, these families are often faced with really hard decisions to make. This is me talking about the services we provide, but if we actually just make it more tangible and we think about the cost of these devices that Dr. Angeli has talked about, the actual cost of these devices are immensely expensive, and they're oftentimes not covered by insurance. And so if you think about our families who often come from different walks of life, they have different socioeconomic status and different backgrounds, they're faced with the need, the decision to be like, can I support my family's basic needs, or can I invest in my child's hearing? And that's crazy to think that these families are often having to make this decision. Quite frankly, it really should never be a decision that a family has to make. We shouldn't have to face debt in order to give your child access to hearing technology and the services that we provide. We want to give every child the opportunity to learn speech and language, and to ultimately give these children an opportunity to become successful members of our modern day society. And so we really couldn't provide the majority of the services that we do without the philanthropic support of the Children's Hearing Program. And that's really our mechanism of keeping these doors open, and really just ensuring that we have the specialist here to provide that support for these families.
And I know you mentioned like all these amazing services that thanks to, donations and philanthropy, we're able to sustain because we see that they're important, that they make an impact on these children's lives. Um, but I know there's more to what you guys offer. And so I would love for everybody to hear that. But besides the services, what happens when maybe a child comes in and can't afford a hearing aid? They don't have insurance, and so they need a cochlear implant eval. What do we do with those kiddos?
Yeah, and that's really the reality of a lot of the patients that we see, and that may be surprising to maybe some of our attendees to think that, but we see patients from, like I said, different walks of life, and the goal of the Children's Hearing Program is to reach every single child, hopefully early enough in their hearing loss journey to make an impactful difference in their life. And we aim to be the model that other clinics can really, we want to be that example for other clinics to follow. And we stand firmly in believing that it's really not fair to a child that maybe their parents have a different socioeconomic status, race, ethnicity, or even documentation status. Hearing is really a right to all of these children. So we do not turn children away, and we can immediately connect our children with one of our CHP funded positions like our social worker to really assess barriers and what are the needs and how we can get this. In addition, the CHP, we've had such grateful donations and donors to develop loaner programs for these families. So we have a hearing aid loaner bank called the OHAB Bank, Oliver's Hearing Aid Bank. And then we have a cochlear implant loaner bank called the SAM Fund, which is Sharing Auditory Miracles. And indeed, these programs exist because, these donors recognized how costly these devices can be. And really, no child should be without sound, and no child should have, a less opportunity to not have access to this technology. And so we are grateful, but the only way that these things happen, and the only way that we can keep our doors open and keep seeing all children, no matter where they come from, is through that philanthropic support for the Children's Hearing Program.
Yeah, and that's truly amazing. And of course, I love that acronym, Sharing Auditory Miracles. And Dr. Angeli, as one of the neuro-otologists on our team, like you're usually that miracle worker. What do you do if somebody reaches out to you and is like, help, I know my child needs this, but I don't have the resources? How has it been for you being linked as part of this children hearing program made a difference, and you being able to provide this amazing medical care that you do offer?
Well, like Dr. Sanchez alluded to, we don't turn anybody away. And if it has to be done, our services and time, often we offer it pro bono, not just me, but also my colleagues. And the institution also is being receptive. But there is a cost associated with the implants, with the services, with the testing, even things that we don't realize, like batteries. The cost of keeping up with the cost of batteries for a hearing aid can be quite a big thing for a family. Also transportation. Some of these families come from very far. We service patients. Just today, this morning, I saw a patient from the Key West, and then later I saw a patient from Martin County. So we see patients from all Southern Florida. They come to us because of our reputation and because of the services that we offer that are not offered anywhere else in Florida, I would say. At least the comprehensive approach that we have to the management of the hearing loss. And some of these patients have to pay money to get here to see us. So that's why we've been opening satellite clinics across South Florida. And these satellite clinics are costly. They're not cost effective because it's a lot cheaper just to have everything housed in one place, but we don't want the barrier of transportation to be a barrier for patients to come to us. So we have clinics all the way up to Palm Beach Gardens and South Kendall in Miami-Dade County. And we try to, we have to recruit people to work in these clinics, and we have to have the diagnostic equipment, and we have to make it easy for our patients to come and see us. Otherwise, our intentions won't be effective.
Yeah, and it's amazing to hear that amount of expansion. And even when I'm listening in as a member of the CHP team, like it's astonishing. It still gives me goosebumps whenever I hear us talk about everything we offer, which makes us extremely unique. And like you said, Dr. Angeli, we're trying to make things easier, right? This is a difficult time. It could be a difficult diagnosis. We want to make it easier as possible for the family. Dr. Sanchez, do you want to expand any more on how other ways that, in terms of our service delivery model, in addition to satellites, what other things does CHP do to make sure that we're reaching patients in their environments?
Of course, we offer telehealth services. So from a clinical model, the other thing that we've done, and honestly, this has been maybe one of the few positive things as a result of the COVID pandemic, but, we have offered telehealth services across the state of Florida. So a patient doesn't have to live in Miami, they could live in Tallahassee and still get telehealth services, obviously to the capacity that we can. But this has been enormously important, especially for our family support team, who are often providing counseling and support, like our psychologist, our social worker, and our educator. And above that, we also are a hub to a lot of medical tourism across the world. And so we actually see a lot of children coming from other countries. It might be surprising to people here, but we see patients who come from maybe islands that are in the Caribbean who don't have audiology at all in the entire island. There's not an audiologist that exists. And those babies are also born with hearing loss, and they come to us for some resources to help those children here as well. As we last review it, we saw patients from over 50 countries last year, from as close to the Bahamas all the way to as far as Russia. So we really kind of are expanding our breadth. But outside of the clinical model, because we've talked a lot about what we do in the clinic, we really love to do all of the other stuff in the community. That's probably the bread and butter of how our family support team impacts, the community. So in collaboration with these individuals, we host and organize events for our families. So specifically events for children with hearing loss. One of my most favorite ones is our Halloween event. Halloween, on the surface, it seems like a fun event, and it's, a silly trick-or-treating event, but the reality is that some of our families sometimes express concerns to us like, well, my child has hearing loss and it's really dark outside and they haven't really fully developed their speech. So I don't want to put them in a position where they have to knock on the door and say trick or treat, because my child can't do that just yet. And so we created an event about 6 years ago called our trunk or treat, or our not so scary Halloween party that converted into a trunk or treat. And it offered an opportunity for kids to dress up and network with one another, because having community and having this kind of solid foundation of a support network that you have with your medical specialist is one thing, but to develop a community of your other people who are just like you, other families, other parents going through the same exact journey, is far more impactful than it is how we can help the patients in the clinic. We see patients for an hour, 30 minutes, once every 6 months, every year, but the impact that having a community of other families that are going through the same thing is just far more valuable. It's priceless. We collaborate with the Marlins. We had opportunities for our children to get on the field and sing "Take Me Out to the Ball Game" in their own way. And it was such a special event for our kids to feel like they're also included and they're showcased as the most important attendees of those games. And in addition, we offer from like a more of a community just spreading the word about what we do. We offer support hearing screenings at healthcare resources and fairs where we can just promote our program and educate the community on what we do, not only with the Children's Hearing Program, but at the Ear Institute in general, where we can educate a lot of adults so that they can kind of inquire, well, should I get my child tested for their hearing, or should I get my hearing tested? And so we're always pushing that envelope forward to make sure that we promote the program from every capacity. And then internally with our specialist, we, I might be biased, but I tend to say that we work with the most brilliant group of people. And another thing that we pride ourselves in doing is that we do a lot of research internally to push this field forward. And when we get the opportunity, our team presents locally, nationally, and internationally at conferences so that we can showcase not only the results of our research, but really how our program is changing this field and really being the exemplary kind of point so that other programs can really emulate and model after. So that's kind of all of the ways that we're really expanding our breadth outside of the clinic walls.
Yeah, and I mean, you said so much in that, in those, few minutes, things that I heard were, CHP just doesn't do the management of hearing loss, but, we also view that these are families. One is a psychologist, obviously, and the director of the family support services. The passionate part, that makes me happy, that makes me smile all day is when we could do to define them, that they realize that there's other people going through the same thing. And everyone, is so different and so special. And they love to see their doctors, Dr. Angeli, the other, otologists who come, they love to see their audiologists. They love to see that we are also part of that family, that they, that we are their cheerleaders, that we are their support group. And so it's amazing to hear that, you guys do these community events, but you also look at a lot of professional trainings, right? To raise awareness, to train the next generation of individuals that are going to come into the field, right? As we're not always going to be here, we need to make sure that that future generation also has this amazing skill set that is so unique. You touched upon like presentations, which also is a different, an area that I know is really important, not just to the Children's Hearing Program, but also to the Ear Institute. So I'm curious, Dr. Angeli, do you want to expand at all of how, CHP and the University of Miami Ear Institute also make sure that we are contributing to science and moving the field forward?
Yes, that's a great question, particularly because I feel lucky that I spend my days working with very brilliant people that are also very compassionate and care for, they have a passion for what they do and they care about their patients. And we have not only surgeons, but also audiologists, but also research people who do nothing but just to ask questions and try to answer those questions. How the ear mechanism works, when it breaks down, what's going on, how can we fix it? And those questions are difficult and require a lot of time and resources. And we have very successful researchers who have been able to get grants from NIH and all institutional wise. But we also have many needs. And sometimes those grants are very good for a number of years, but then they're end. And then we need to look for other sources of revenue to support this research. And research is a very important part of what we do because we know that science changes continuously. It's a very dynamic process. We need to be, up to date so we can offer our patients the best personalized care and the most effective care and for their problems. So we need to keep up with that research. And our researchers not only spend their time doing work in the laboratory, they also work with patients, trying different options for hearing loss. And they go around the country, networking with other researchers and presenting our data and making us at the Ear Institute and the University of Miami very, very proud of all this work.
Yeah, and what I truly love about this team is that, no research question is small, right? So we go and do things from the basic science, right, to the hard science, to figuring out how we can actually treat and identify from the genetic hearing loss, but all the way to very practical or translational research on How can we reduce parenting stress? How can we get more input about hearing loss? So I love the fact that this team is able to kind of look at all angles and equally sees the importance of contributing in all aspects of research, from audiology to otology to psychology or even education, which really goes to show how you guys have developed this amazing team that works together so easily. And I think along those lines, we've heard so much, Dr. Angeli, of all of this amazing things that CHP does, but a lot of it, right, is dependent on philanthropy and support. So what can people do? How can patients and families support the Children's Hearing Program?
Well, just by being here, you're supporting us. You're giving us the motivation to continue our work. And by coming to see us and by just seeking us for your hearing healthcare is a great motivation, and we appreciate it very much. Of course, we need the resources to support all our services, particularly the services that are not reimbursed by insurance or by the different mechanisms of research. That sometimes we need more money than our needs are very extensive. Our patients' needs are very extensive. So anything that you can do to support us is great. We very judicious. We make very judicious use of the money. We try to put it into patient to support our patients first. We have our center to support our patients and their families, especially pediatric patients, and that goes not just to support the educational needs and the social worker, but also sometimes just buying parts for their hearing aids or their cochlear implants that they need on a, if you depend on a cochlear implant to hear, if the implant breaks down, you can't wait a month for the insurance to approve your new battery or your new device. You want something right away. You cannot keep a child out of the school for a month waiting for a part to arrive. So we many times troubleshoot and try, help the patient solve the problem immediately until we get reimbursed, or even if we don't get reimbursed. So those are services that we appreciate, where we need the support the most.
Yeah, and I would add, Caitlin will have an opportunity to talk at the end of this webinar, and she's, our major gifts officer, and she put her contact information in the chat for individuals if you are interested and have the capacity to do so. But really, no donation is small, and I've really seen, as someone who sees kids every single day, the impact of this support is really, invaluable. And what philanthropy has done so far, we've kind of already talked about. We fund several positions, largely Dr. Sehas's position, and then in addition to our other multidisciplinary specialists. But that loaner bank that Dr. Angeli has described, and we can expand our support for different communities and training other medical teams on how to follow this model. So really, nothing is small, and we have a unique opportunity with this match that Caitlin will talk about briefly at the end. And not to belabor that topic, of course, but it is really a unique opportunity that we are very hopeful for.
Yeah, and both of you really hit this point that no gift is small. Everything is useful and it's helpful, and I love that this organization really uses those funds to directly help the children and families. It is not like some other places where X goes to administration and things like that. It is directly going to these patients and families that are walking through these doors. It is going to these patients in needs in our community and anybody really who needs that extra support. So it's amazing. And I'm sure, we all kind of sometimes probably wake up in the morning of like, this is what we get to do, every day. And no family is ever the same. And so I think this is what makes it so rewarding in many ways, but it isn't possible. Like we all said, it's not possible without getting this continuous support so we can continue expanding. And I know we're kind of getting close to the end, but I would love one last question for both you, Dr. Sanchez and Dr. Angeli. But if one of you, or if we have time, both of you could share what's one of the most powerful moments you have experienced as part of the Children's Hearing Program. I see Dr. Angeli's hands up, so I'm going to let him go first, and then we can move on to you, Dr. Sanchez.
Well, I wanted to expand on what you said before, and I think a word of appreciation is to go to Barton G. Weiss, who donated the initial monies to set up the Family Resource Center. So I want to, take advantage of this podium to extend my appreciation to the Barton G. Children Family Support Center. Regarding there are so many moments that make my life so happy when I see these children. It's amazing because we sometimes see the babies and then we end up, this is a journey that takes many years. You make relationships with these patients and their parents and their families for years and years, and you see them grow up and develop. And that's just perhaps one of the most cherishing moments. I mean, I love to see the pictures when they're babies and then when they grow up and how their hearing cochlear implants changes in color and shapes as they become teenagers, and they're more conscious of fashion, and they look for cochlear implants with different colors or different styles. Even I had a young woman recently tattoo a cochlea behind her ear, where the side where she places her cochlear implant. So it's these human experiences is just what makes my life so great every day to see these kids develop.
And how about you, Dr. Sanchez?
I would echo that. I feel very fortunate to be a pediatric audiologist. I think I have a very unique opportunity, and sometimes part of my job is very difficult, as I am, the one, maybe the first person to diagnose that baby with hearing loss and really kind of break the news to the family. And that doesn't weigh very lightly on myself either. Really, to get the best care, you really have to feel it with the family, and every family is different. And I try my hardest not to be jaded by this, as we have such a high volume of patients that it's not just, oh, I'm doing it all over again. It's really such an individualized experience. And I feel really fortunate because these families end up trusting me to really take them on this hearing journey. And, how could you ever deny the amazing opportunity that it is to witness a child hearing for the first time? And I get to be a part of that, and I get to really facilitate that by fitting hearing aids on babies and activating the cochlear implants, and what you would commonly see on those YouTube videos. Like, I get to do that every day, and it's something that I definitely do not take for granted. And I would say that every experience, sharing those moments with the family when they're the most vulnerable, is something that I am very honored to be a part of with these families. And I feel like I'm a part of their family in some regard. And it's really something that it's really just my passion, and it's the why behind what I do.
Wow, thank you. And thank you to both of you. And, something that, Dr. Angeli, kind of mentioned is that we've had very, gracious donors who's allowed us to be able to do what we do. If it wasn't for many of them who started, right, to give these gifts and donations, we wouldn't have been able to, provide this high quality and comprehensive care. And we want to continue to do that. We want to continue to expand. And we obviously have the amazing team to do that. So I think this is a perfect segue for me to introduce Caitlin Gimbel, who is our major gifts officer for pediatrics, but she's really just an extension of our team and has been on this journey and learning with us as an individual from the Medical Development and Alumni Relations Office. So I'm going to pass it on to her so she can give us more details of how you guys can help and support to continue this amazing children's hearing program. So Caitlin?
Yeah, thank you so much, Dr. Sejas, and also to the other doctors on the call today. I know it was even challenging to schedule this because you're so busy with all of your patients serving them. But it's so incredible to hear your passion come out. And I have to say, in the first few weeks of work, I actually went and did a tour of the CHP at the Ear Institute, and I was blown away, not just by the technology, and I know most of which doesn't really exist in most places in the world even, let alone the United States, but the team. I mean, everyone was so joyful and clearly loved what they did. And so for me, that really struck me and just really warm hearts. So I want to also thank the donors that are on the call today. I know there's several of you on, a lot of different supporters joining. and our patients that are joining today to just try to get a little more clarity, perhaps on what they're experiencing. So thank you all for joining. And I wanted to also reiterate the Children's Hearing Program match, which is supported by the Batchelor Foundation. They're incredible philanthropists, and they've supported so many different divisions of pediatrics at University of Miami. But what they're offering is when we raise $500,000, they're going to match that with $500,000. And that money goes into a fund that is kind of our security blanket. And that ensures that moving forward for years from now, we are going to be able to continue to do what we do and expand on that. So major thank you to the Batchelor Foundation as well. The deadline is February 15th. So, you know, as the end of year is coming and it's giving season, like they said, consider giving the gift of sound to children that really need it. And I would love to connect with you even outside of this match. There are so many ways that as they've already explained, to support philanthropy. So my contact information is in the chat. You can do that. You can also find the link to donate to the match in the chat as well. And the last thing I really want to stress is, and something that I've come to realize, not everyone, many of our donors give because they had incredible experiences and they're so grateful. But also some of our donors are giving because when they were children, they didn't have access to this and they struggled. And there was so much that they went through that they want to make sure other children never have to experience. So I think keep that in mind. You know, everybody's coming from different backgrounds. And we all have our own experiences. So I'd love to work with you and figure out how to make a meaningful gift that really speaks to you. So thank you so much. And I'll let you close it out, Dr. Sejas.
Yeah, and thank you. You know, that was a wonderful description too, from your perspective, you know, Caitlin. And we just want to take this, you know, on behalf of, you know, Dr. Sanchez, Dr. Angeli, the entire Children's Hearing Program, and the University of Miami. We want to thank you for taking an hour of probably your busy lives, whether you are a donor who has been supporting, whether you're considering donating, or whether you're a patient who was like, wow, I get to work with this amazing team. You know, everybody matters. We are all members of the same University of Miami CHP family. And we want to continue to figure out how we can make things easier for, you know, the future generations, for pediatric hearing loss in general. And so, as Caitlin said, it's in that chat. So feel free, you know, her information is there. But if you come to our clinic and can't remember what her name is, let us know. We promise we'll get you in contact with her and our amazing development team. And once again, thank you so much. And I hope everybody has an amazing rest of their day, an amazing holiday season. You know, this is the time to open our hearts and realize that there is opportunities if you have the possibility to give back. And I can say wholeheartedly that CHP is one that we will use every dollar of it to make sure we improve the outcomes and the lives of individuals with hearing loss. So thank you so much again.